The nephrologist may observe the major blood vessels of the kidney by X-ray. Using a microscope, he may see glomeruli and tubules, including details of Bowman's capsule and the origin of the proximal tubule, the glomerular capillaries, and Bowman's space. By tracing the outlines of such thin sections on wax plates, the tubule may be reconstructed. In this way, Peter modeled an adult proximal tubule. Huber reconstructed the glomerulus and convoluted tubules of an embryonic kidney. His model includes a complete loop of Henle. By microdissection, Peter and Oliver isolated entire loops of Henle from human kidneys and located their turning points in the medulla. The peritubular capillaries are not shown in these models. William Bowman had earlier suggested that the glomerular efferent vessels supply the capillary network around the proximal tubule of the same glomerulus. Cushney extended Bowman's concept by proposing that Henle's loop was also perfused from the same efferent. Thus, the diagrams in most textbooks are based on incomplete evidence. The understanding of renal function requires accurate knowledge of vascular and tubular organization. This film has been made to show some important aspects of that organization. The arterial system of this dog kidney has been partially injected with red silicone rubber. Some aspects of renal structure are immediately apparent on the cut surface. The entire kidney is enclosed within a fibrous capsule. Within this capsule lies the cortex. Medullary rays composed of Henle loops and collecting ducts pass from the cortex into the outer medulla. The outer medulla has a prominent lower border. The inner medulla extends to the papilla tip, which is free within the renal pelvis. The kidney is dehydrated in alcohol and then cleared in methyl salicylate. By time-lapse photography, we see how clearing makes the silicone-filled vessels visible without removing or distorting the tissue. Slices of cleared kidney are studied using a photomicroscope. Details of the vascular organization are difficult to see in completely filled specimens. By using less complete injections, the interlobular arteries and glomeruli are made clearly visible. At the surface of the kidney, just beneath the capsule, glomeruli have efferent vessels which are long and reach the surface of the kidney before dividing into a capillary network. At different levels within the cortex, the efferent vessels have different patterns. For example, this mid-cortical, highly convoluted efferent vessel, or this efferent, which directly supplies Henle loops and collecting ducts. In the inner cortex, the glomeruli have long efferents which extend downward. These efferents divide to form the vascular bundles of the outer medulla. Small vessels diverge from the surface of these bundles at the lower border of the outer medulla. Only the central vessels of the bundle extend into the inner medulla. To show the relations between vascular structures and tubules, a micropipette filled with white silicone is inserted into Bowman's space of a chosen glomerulus. This glomerulus is of the subcapsular type. By micrometer syringe, the white silicone is forced into Bowman's space. From the space, it fills the transparent proximal tubule. Clearing agent already in the tubule interrupts the column of silicone and makes the flow visible. Due to the shallow depth of field, focus is sometimes difficult to maintain for the whole depth of the preparation. The tubule forms convolutions which are packed closely together and extend to the surface of the kidney. These convolutions are perfused by the efferent network arising from the same glomerulus. The pars recta is perfused by efferents of midcortical glomeruli. As shown in the scale drawing, the midcortical efferent vascular patterns are different. This glomerulus has an efferent which divides into a long mesh network above. The early part of the proximal tubule is associated with the efferent of its parent glomerulus, but much of the tubule is clearly perfused by vessels arising from other glomeruli. The pars recta extends downward through the inner cortex. Intercortical efferents form the vascular bundles of the outer medulla. The efferent of this glomerulus extends downward to form such a bundle. The proximal convoluted tubule is located above the glomerulus. It is entirely dissociated from the efferent vessel. The pars recta descends between the vascular bundles. To review, the outer cortical convoluted tubule in brown is perfused by its own glomerular efferent, but has a pars recta perfused by midcortical efferents. The midcortical convoluted tubule is only partly perfused by its own efferent. Its pars recta is perfused by the efferents of deeper glomeruli. The intercortical convoluted tubule is entirely dissociated from the efferent vessel. Let us now examine Henle loops and distal tubules. The outer cortical glomerulus has a pars recta perfused by midcortical glomeruli. The tubule descends past the vascular bundles. It turns near the junction of the outer and inner medulla. The ascending and descending limbs of the loop may be separated or close together. The ascending limb has the same blood supply as the descending limb. At the glomerulus, the distal tubule begins. It follows along many of the proximal convolutions and shares the same vascular network. It then joins with a collecting duct. The midcortical tubule is partly associated with the efferent of its parent glomerulus. The pars recta is dissociated. The descending limb extends beyond the region where outer cortical tubules turn. It passes deeper into the inner medulla, where it is perfused by vessels extending from the core of a vascular bundle. Such intermedullary vessels were only slightly filled in these preparations so that the tubule could be easily seen. This tubule, which originated in mid-cortex, turns near the midpoint of the inner medulla. No change in lumen diameter is observed as the thick ascending limb begins. Again, we see that the distal tubule shares a common interstitium with the proximal convolutions. The inner cortical proximal convolution is entirely dissociated from the efferent of its parent glomerulus. The pars recta descends between the vascular bundles. Almost all the tubules originating in the outer and mid-cortex have turned back at this point. Only the inner cortical tubules extend with the collecting ducts to the region of highest osmolarity near the papilla tip. The loop of Henle turns at a point deep in the inner medulla. Although the flow of silicone appears rapid here, the speed is in good agreement with the flow rate of canine tubular fluid calculated from reported transit time. The distal tubule is short and passes along the convolutions of the proximal tubule. The connecting piece extends upward to join a collecting duct. Thus, each distal tubule is in contact with the proximal tubule from the same glomerulus. The Henle loop of the outer cortical glomerulus ends near the junction of the outer and inner medulla. The midcortical loop ends near the midpoint of the inner medulla. The inner cortical glomerulus has a loop which extends almost to the papilla tip. Tubules alone have long been considered the functional units of the kidney. But tubule function depends on the relation between each tubule and its vascular supply. These relations are more complex and highly organized than was indicated by Bowman or Cushney, and are quite unlike many popular diagrams. With this complexity may come better understanding of normal and pathologic function. As this outer cortical convoluted tubule is perfused by the efferent from the same glomerulus, the osmotic properties of the efferent blood may affect its reabsorptive capacity and hence glomerular-tubular balance. If such factors operate, then reabsorption from the pars recta may be influenced by the efferent blood from many midcortical glomeruli. Thus, the balance of filtration and reabsorption may require the coordinated activity of large groups of glomeruli with their associated tubules and blood vessels. The entire lower part of Henle's loop is perfused by inner cortical efferent vessels. Interruption of this efferent pathway could result in generalized ischemic injury to this part of the tubule. Such injury might lead to the condition known as lower nephron nephrosis. Ischemic lesions in midcortex would be limited to the short tubule segments perfused by each midcortical efferent. Thus, the pattern of midcortical perfusion may explain the patchy lesions of acute renal failure. The patterns seen here do not fit the classical concept of a unit nephron. Perhaps through further studies, we may ultimately discover the real functional unit of the kidney.